Tonight, the health care hangover. One day after House Republicans rush through a bill that will take health care away from millions, we get a behind-the-scenes report from a no vote yesterday. Congressman Sean Patrick Maloney. Plus, I'll tell you where I stand. Here's a hint. I ain't happy, and you shouldn't be either. Then the politics of the health care bill. That's the Hudson Valley Congressman John Faso promised a constituent he would protect her and her pre-existing condition. Well, yesterday, he broke that promise. And later, an aspect of the GOP health care bill you may have not considered, the impact it will have on state and local governments. How can they keep everybody covered with a whole lot less coming from Washington? And also, what the almost impossible choices elected officials will now have to make. Good evening, everyone, and welcome to RFL. I'm Richard French. Thank you so much for joining us this Friday evening. As you can tell, we are dedicating much of this program this evening to yesterday's House vote on the GOP's Trump Care bill. Now, we will get to Congressman Maloney and our panel in just a moment, but I want to begin tonight with my thoughts on yesterday's vote. It's where I stand. Let's start tonight with what we were promised.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of, much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
That, it turns out, was a big, fat lie. 24 million Americans will lose health coverage. Many states, they're going to be left holding the bag. Medicaid, they'll be decimated. And people with pre-existing coverages will be abandoned. The abomination that passed in the House yesterday and celebrated with unmatched tone-deafness smugness, it was far worse than a broken campaign promise. It was an intentional effort to not only rob the poor to give to the rich, it was an intentional assault on the most vulnerable Americans. But somehow, to listen to our president kicking millions of citizens to the curb was not only a broken promise, but proof positive of how he was making America great again.
Make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it. So what we have is something very, very incredibly well crafted. And this is a real plan. This is a great plan. And we had no support from the other party.
It's an awful plan, and even 20 Republicans voted against it, but it passed by a one-vote margin. I'll get back to the president in a minute. But first, let's start off with the optics of yesterday. Now, if what you see is a bunch of chubby white guys beaming ear to ear, you'd of course be right. But remember this image, because I guarantee you, you're going to be seeing, if we could show that clip again and again between now and November of 2018, those pictures of Republicans so proudly voting for it. Well, now, let me just remind you of what happened afterwards, if you didn't hear. After the photo where all of those guys stood shoulder to shoulder here, happy as clams, old friend Tom DeLay, remember him? Reportedly, he joined those fellow Republicans and they cracked open cases of Bud Lights and fired up stogies. I kid you not. If they were considered winners yesterday, and I will bet dollars to donuts, it will be a short-lived victory, if that, but they certainly did make a few folks happy. Rich folks actually made out like bandits. Now, if you make more than $200 grand a year, and you can multiply that in terms of the actual benefits coming to people making millions like Trump, you got a nice tax cut. Ditto if you have enough coin to have a health savings account. Now, if you're a large corporation, I want you to think about this, everybody who works for a company. Think about what I'm about to say. A large corporation yesterday in the bill no longer has to pay a penalty if they do not offer their own employees health coverage. Now, let's get to the losers, and trust me, this list is going to take a whole lot longer. How about we start with honesty? You may remember when Obamacare first passed, Paul Ryan at the time said, how could anyone vote for something if they've neither read the bill or even know how much it costs?
I don't think we should pass bills that we haven't read, that we don't know what they cost. I mean, I don't think that's being effusive.
Apparently that was then and this is now, and now we say hello to hypocrisy. The bill has not been scored by the Congressional Budget Office, so we have no idea of the price tag and the consequences. And as New York Republican Congressman Chris Collins proves, they have no idea what's in it.
Did you actually sit down and read the entire bill plus all of the amendments?
I will fully admit, Wolf, I did not, but I can also assure you my staff did. We have to rely on our staff.
Okay, more importantly than the truth is going to be the human casualties here potentially. Take a look at the list of pre-existing conditions, and I want you to tell me who you know in your personal life would target disabled children, victims of sexual assault, pregnant women, veterans. The list goes on and on here. The fallacy that somehow putting $8 billion into the kitty, that would make the pot right, that also is absurd. Take a look at how much they put in and take a look at just how much it would cost. And somehow that changed votes, $8 billion over 5 years. Take a look at the number over 10 years, and a lot of people are saying that's modest. It's probably more like $25 billion a year. But as a consequence, a whole lot of people are going to be hurt. Now, the massive shortfall is that people with care now will be dumped into what's called high-risk pools, and it gets worse. Medicaid, it would be cut by nearly $900 billion over 10 years, decimating care for things like special ed for kids, funding for the opioid epidemic. Remember all the press conference on Capitol Hill about that? Say goodbye. So the question is, who will pay the biggest price? Well, try the elderly, the poor, the sick. Where do they come from, you may ask? Well, you may know some of them, but where are they most concentrated? Take a look at the states on your screen. I'm going to tell you what they have in common. They have the sickest people, they have the people most in need, they have the most amount of people that need Medicaid. By the way, they're all Republican states. They're states that trusted Trump on the campaign trail, and they helped get him elected. This bill is so bad, it actually managed to do the impossible. After its passage yesterday, I want you to think about that trifecta here. You had hospitals, doctors, and even health insurers agreeing that this would not constitute reform. As one said, it would be an utter debacle. At the end of the day, what we saw in Washington yesterday was the opposite of political courage. It was craven political cowardice masquerading as achievement. It was a shameful day in Washington. I don't care what happens in the Senate. This is something no one in Congress should be proud of, and I guarantee you there will be political consequences. All right. We will jump to a quick commercial break. When we come back, I'm going to bring into the conversation Congressman Sean Patrick Maloney. He was a no vote yesterday, but not all New Yorkers representing us in Congress, let alone the folks in New Jersey and Connecticut, did as well. He's going to tell me what he's hearing from his constituents and what he believes will be the fallout in Washington. Stay with us.